Hello, we are from SGDB 5. Now we will explain about our student project about cardiac tamponade. My name is Ferdinand with digit number 108. So this is our members. First, about the introduction. Background. Cardiac tamponade is a class of disease that involve the heart or blood vessel. Cardiovascular disease include coronary artery disease such as angina and myocardial infarction. As we know, heart function is to maintain a constant flow of blood throughout the body. Cardiac tamponade is a medical emergency or injury that occurs when enough fluid builds up in the pericardial sac that compresses the heart and result in decreased cardiac output and shock. The incidence of tamponade, based on our literature, about 0.05%, with mortality rate around 14.3%. With subgroups with higher mortality are sepsis, chest trauma, metastatic cancer, acute kidney injury, and idiopathic. The diagnosis of cardiac tamponade is a clinical diagnosis that requires prompt recognition and treatment to prevent cardiovascular collapse and cardiac arrest. Treatment of cardiac tamponade can be performed at the bedside or in the operating room. This is the formulation of problem, purposes, and the benefits.
My name is Aini Putri Adinik, student number 141. Cardiovascular tamponade is portrayed by hemodynamic instability because of heart pressure by amassing of fluid, blood, cluster, or gas in the pericardial space. CD is a pericardial disorder portrayed by deprivation of the diastolic filling of the ventricles, causing decrease of cardiovascular result, typically creating sign and indication of heart failure if untreated.
My name is Anastasia Vaniatrixi Kusianto, student number 138. I will explain about the epidemiology of cardiac tamponade. Cardiac tamponade can be caused by pericarditis and pericardial effusion. Acute pericarditis occurs in 0.1 to 0.2% of hospitalized patients for non-ischemic chest pain. Other than that, prevalence of pericardial effusion is around 2 cases per 10,000 populations. Large idiopathic chronic pericardial effusions, which happens in women more than 50 years old, are associated with high incidence of cardiac tamponade. Thank you.
The etiology of cardiac tamponade are cancer, tuberculosis, infection, acute aortic disease, trauma, renal failure, systemic inflammatory disease, and complications of cardiovascular intervention. Complication of percutaneous cardiac intervention is most common cause of cardiac tamponade. This contributes to 36% of cardiac tamponade. About 23% of cardiac tamponade caused by malignancy. The third most common cause etiology is infection that contribute to 15% of cardiac tamponade cases.
So hello everybody, my name is Lalita Samalawi, student number 156, and I'll tell you about the pathophysiology of cardiac tamponade. Cardiac tamponade is a rapid accumulation of fluid in the intrapericardial compartments and leads to increase in the pericardial pressure above resting value. The most vulnerable one is the right atrium because of the thin wall, but also intracardiac pressure and surrounded by a pericardial effusion completely virtually. Its pressure can reduce the venoatrial gradient and prevent the heart from expanding completely and filling to capacity with blood. Then the diastolic filling will be decreased and leads to the decreased cardiac output. Less or no blood will leave the heart, and it will lead to the decrease of oxygen that reaches the tissue. To overcome the reduced output, the first compensatory sign is tachycardia. Other than that, the systemic venous return will be limited and the filling of the right atrium and ventricle will be impaired. Then other symptoms will come. At the end, the patient will experience a loss of consciousness to sudden death. Thank you.
Hi, I'm Wanda with student number 133. I'll explain about the diagnosis of cardiac tamponade. So the diagnosis of cardiac tamponade can be established by history taking, physical examination, and investigations. Patients may present with non-specific complaints such as chest pain, shortness of breath, palpitations, dizziness, syncope, and mental status changes, making it difficult to make a diagnosis based on clinical signs alone. Hypotension, jugular venous distension, and muffled heart sounds are classic clinical findings called backstriate that can help make the diagnosis of cardiac tamponade. Other physical examination findings in cardiac tamponade patients include pulsus paradoxus, Kussmaul signs, and Ewart signs.
Hello, my name is Kristina Paramita Kornimaya with number 70. Investigations can be performed with several modalities, including ECG, chest X-ray, and chest CT scan. The most common ECG finding of cardiac tamponade is sinus tachycardia. The ECG may also show low voltage or electrical alternates due to the swing of the heart within the fluid-filled pericardium. But these findings are rare. A chest X-ray can show an enlarged heart, and a CT scan can detect a pericardial effusion. Thank you.
Hello, my name is Pratista and my student number is 127. So now I'm going to explain the treat or management of cardiac tamponade. Pericardial effusion is the basic form of cardiac tamponade and has two basic groups of treatment. There are pre-tamponade patient with stable hemodynamically and pre-tamponade patient with unstable hemodynamically. Unstable patient needs emergency intervention, so the definitive treatment is pericardial fluid drainage, thereby reducing myocardial compression.
My name is Diaz Bauscaras, to number 168, Treatment and Management. There is some condition that indicates drainage. First, cardiac tamponade with hemodynamically stable. Procedure should be performed within 12 to 24 hours of diagnosis, after getting laboratory results, including routine blood exam. Second, indications for urgent surgery, cardiac tamponade, including hemopericardium due to type A aortic dissection, rupture of the ventricle wall, in acute myocardial infarction, trauma, or purulent effusion in septic patients who are unstable, and irreversible localization of the effusion managed percutaneously.
Hello, my name is Putri Agnes Monica with number student 100. So let me explain more about the pericardial synthesis as a definitive treatment for cardiac tamponade. So there are multiple factors that must be considered before we decide to do pericardial synthesis. First is the number and location of effusion. Second is hemodynamic state of patient on echocardiography. And the third is the adequate margin for free space so we can prevent the laceration. And the fourth is clinical indication and also urgency for the patient. And the five is the underlying etiology, and the last is the bleeding tendency. So after we consider the several factors, there are several basic steps for pericardial synthesis. So first is the pericardial synthesis can perform with echocardiographic guidance, and we can place the patient at about 30 until 45 degree, and then we can connect the patient to the echocardiography monitor, and we use the needle 18 size, and also we can inject the needle with 45 degree on the patient's skin, and after that we can aspirate the fluid. And after we got the sample, we can send this to microbiology, biochemistry, and cytology laboratorium.
My name is Putu Arari Bramantia with student number 181. Cardiac tamponade is a medical emergency and without treatment is invariably fatal. The key is the timing of intervention. The longer the delay, the worse the outcomes. If untreated, the patient may develop the following complications such as pulmonary edema, cardiogenic shock, pulseless electrical activity, and even death. The prognosis of cardiac tamponade is typically good with early recognition and management of the condition and the underlying causes of the tamponade. Patients with tamponade caused by malignant disease have death rate exceeding 75% within 12 months.
Hello, my name is Diahi Sutari, student number 173. Although preventing all occurrences of cardiac tamponade is impossible, some acts may reduce the risk of it. First, medical personnel may reduce the risk by minimizing patients' exposure to infections, which can be done by keeping all medical tools and environment sterile. Second, providing proper treatments for medical conditions, such as lupus and hypothyroidism, is said to minimize the risk of cardiac tamponade. Then, the act of maintaining patients' heart health through a balanced diet, regular exercise, and avoiding smoking. Lastly, attending regular medical checkups is important. This way, physicians are able to suspect and/or diagnose the condition as early as possible.
For conclusion, Cardiac tamponade is heart pressure by amassing fluid, blood clusters, or gas in the pericardial space. Cardiac tamponade occurs in patients with pericarditis, pericardial effusion, and etc. Cardiac tamponade happens because of complications of cardiovascular interventions, cancer, tuberculosis, infection, acute aortic disease, trauma, renal failure, and systemic inflammatory disease. The pathophysiology of cardiac tamponade is increased intrapericardial pressure above resting values due to rapid fluid accumulation. The prevention of cardiac tamponade is done by maintaining heart health and doing good medical procedures. Diagnosis of cardiac tamponade is done by anamnesis, physical examination, echocardiogram, chest X-ray, or chest CT scan. The prognosis of cardiac tamponade is fatal if treated too late. The complications of cardiac tamponade are pulmonary edema, cardiogenic shock, and pulseless electrical activity. The treatment for cardiac tamponade is pericardial fluid drainage. So that's all for our presentation today. Thank you for your attention and thank you for listening. See you in the next time. Goodbye.